afternoon, everybody. It's a great pleasure to welcome you to this event. I'm Nicola Jones. I'm a GP in Wandsworth, and I'm chair of Wandsworth Clinical Commissioning Group. So I have to do a bit of housekeeping. There's a snazzy slide for housekeeping. There we are. So we're not expecting any fire alarms. So if you hear one, then please exit the building. If you wouldn't mind to just check your mobile phones are on silent, just as a courtesy to other people. Just to remind people, you've probably noticed that we're filming this. We want to make this event as accessible as possible to as many people as possible, so we'll be filming it and putting it up on our website in the next few days. So if you do stick your hand up and answer a question, we will be filming the back of your head and your voice, but as long as you don't turn around, you won't be directly on camera unless you want to be. So I hope you've been to our marketplace event. It's really great to see some of the work that's going on across Wandsworth. So thank you very much to the people who've contributed to organising that today and the people who've turned up. So in a moment I'm going to hand over to Neil McDowell, who's our Finance Director, but first of all we wanted to hear from Sarah Blow, who is the Accountable Officer for the CCG, and from James Blythe, who is our Managing Director.
Thank you. So James and I are going to whiz through because we're going to do the review of the whole year in 10 minutes. So I hope you're looking forward to that. So just first of all, what do we do? Well, we commission, we plan, we buy, we monitor health services for the population in Wandsworth. We have 40 GP practices that we also commission through a delegated arrangement with our regulators. And what we try to do is make sure that we have the best outcomes. We reduce inequalities, we spend our money wisely, we get the best value for what we do, we collaborate with our patients and with our partners. So that's ultimately what we try to do in Wandsworth. And what have we done this year? Well, I'm not going to talk about the first section. We have split our sections into Start Well, Live Well and Age Well. And the first section is about children, young people, mental health. And we have a whole presentation on that a bit later. So I'm not going to talk about that now. Under Live Well, we have got a recovery cafe, and actually that's been a place for people with mental health locally to be able to go along and to get some support and to meet with others. So they can often achieve some support in that way rather than maybe going to an A&E department. So we've got what we call crisis cafes all over South West London actually. One of the other areas that I'll talk a little bit more about is the extra support for care homes. We are actually looking at population over 60 years old and working with care homes to make sure that people are getting the right nursing support, the right dietary support, the right sort of therapist support. And we're putting in some additional resource to ensure that people are supported in the right way in a care home, which they perceive as their own home, which is absolutely right, rather than having to maybe attend a hospital. So that's a piece of work that we're doing, not just across Wandsworth, but also Merton with St George's as well involved. So that's a really positive piece of work for us going forwards. Because we've got 10 minutes, I'm trying to do it briefly.
Thank you. So I would just like to talk a little bit firstly about how we performed last year, and secondly about how we're taking forward some of our local plans into the future. So this slide, you've got it in your packs, just details how the CCG has performed against some of the key constitutional standards within the NHS. So these are the things that every part of the NHS in England has a duty to meet. And generally, you'll see that for many of the performance standards, Wandsworth has done very well around cancer referrals, around access to diagnostic tests, and also around access to and effectiveness of psychological therapist services. So this is the Talk Wandsworth service that receives about 120 to 130 new patients a week going into psychological therapies. A couple of areas of note. The first is around A&E, so we work primarily with St George's but also with other local A&Es to make sure that Wandsworth patients have good access to care. And on the standard around people being seen and treated or discharged or admitted within 4 hours, we achieved 89.5% against the 95% standard in 1819, and we continue to work with St George's to make sure that people have a really positive and effective experience of care when they attend A&E. We also have been working really closely with St George's around their elective waiting times, because since 2016 until earlier this year, St George's were not able to publish data on their waiting times. We worked very closely with them to review a large number of patient records and to re-establish a waiting list at St George's that could be published, and we are now working with them to reduce long waiters, and we are actually ahead of trajectory in reducing long waiters at St George's and making sure that people have timely access to care. But the challenges facing the NHS are not just challenges for the NHS, and we know that we can achieve more in NHS-funded services if we work in partnership with other organisations. And we do this through the Health and Wellbeing Board, and over the course of 2018-19, organisations in Wandsworth came together to develop what we've called our Wandsworth Health and Care Plan. We held an event last November at the Town Hall, and we asked a very wide number of people to help us, to tell us about what worked well within services, what they thought some of our priorities should be, and particularly priorities where they felt that health and care organisations, so ourselves, general practice, the acute hospitals, but also the voluntary and community sector and our colleagues in local authorities should work together to improve services. And from that, we've developed the Wandsworth Health and Care Plan, and it divides into start well, live well and age well areas, and these are some of the themes that we're now working on. And we're now working with our partners. We've set up a group called Wandsworth Transformation Group, and that group has got representation from all and a number of major partner organisations, and we are working together on our strategies for taking forward these areas. It's not directly listed here, but one particular area that I wanted to highlight, which we're working on with one partner organisation, which is Wandsworth Community Empowerment Network, this year, is around our programme that's recently won some external award money to put in place cardiovascular risk screening, working with local faith-based groups and working out of churches, mosques and temples. And this is a really good example of where we know that we have particular expertise within the NHS. We know that we need to improve access to screening services with our local communities, but actually we need to work on that ability to engage with communities and connect us with communities. So I'll stop there and hand back to Sarah.
So we just wanted to also just tell you a little bit about the future as well as looking back for last year. So we have a programme in South West London called the Moving Forward Together programme, and that's where the 6 CCGs in South West London, that is Merton, Sutton, Wandsworth, Kingston, Richmond and Croydon, are coming together to look at merging in April 2020. So we've been working together across South West London in a really close way for a couple of years, and I'm the accountable officer not just for Wandsworth but for 4 other CCGs in South West London, and from the 1st of October also for Croydon, so for all 6. So we are looking to ensure that we actually have a real borough focus in the way in which we set ourselves up, because we want to make sure that we build on all the really good local work that we have done in the past and that we intend to continue to do. But what we will do is we will make efficiencies by working together, particularly around some of our governance and back office. We have to make 20% savings in order to deliver the long-term plan for the NHS. And what we want to do is make sure we can put that into frontline services and not into additional governance. So we're working together with each of the CCGs, with our memberships, with our partners and others to make sure that we get the plan for South West London right going into next year. And what we have done is developed a way of working with our partners around each of our places, our boroughs, so that we can work together to have a single plan, the health and care plan, and we can bring together our resources to make sure that we deliver that in a way that makes sense for the whole system. So we're going to be asking our membership to give a view on this over the next few weeks, and our intention is to put an application in at the end of September to our regulators. So just letting you know that's the direction of travel, but also just to reiterate the importance of the local borough and how we make sure that as we move forward, we actually do that in a way that makes sense and we kind of release the local system to be able to work together. Okay. Is it finance now? Or? Finance.
Good afternoon, my name is Neil McDowell. I'm the Local Director of Finance for Wandsworth CCG. So my part of the presentation is mainly around the money, so it's looking around where we've spent our money and did we actually achieve the targets that we were set. So just a bit of context in terms of Wandsworth CCG receives around £500 million worth of funding. And this is based on the number of patients that we've got registered with GP practices within Wandsworth CCG boundary. This slide here really sets out where we're spending all our money. So you'll notice that just under half of the money goes on hospital services, so that predominantly is St George's, Chelsea and Westminster, Guy's and St Thomas and Kingston Foundation Trust. Then it's followed by mental health and community services, which is predominantly South West London St George's and Central London Community Health as the community provider. And then we've got the commissioning of GP services, followed by prescribing. Also contained within the corporate and support and estates is our admin budget. So this is where we have a capped amount of money that we can't spend and we can't breach. So that's currently at £20 per head of population, and I'll come on to whether we achieve the target on my next slide. So these are the main targets. So the first one was, did we spend the money and not exceed the budget? So yes, we managed to hit that target. We got a full unqualified audit opinion, which basically showed that we'd used our money in the most effective way by coming in on a break even. One of the other areas that we have to invest our money in is around mental health. So we have to put in at least the growth in our money that we receive, plus an extra amount into the mental health area, and we've actually hit that target. And then also, as I mentioned earlier, do we need to stay within the running costs, so the £20 per head of population, and we managed to do that. We actually were slightly under that target. So I think in conclusion, I would say we've had a successful year in that we managed to hit the targets that we set. I think it was against the backdrop of a very challenging financial picture overall. So Wandsworth CCG has hit its statutory duty as it has done since its inception in 2013. I think moving forward to 1920, it will be no different. There'll be another challenging year ahead of us. However, having hit the targets that we've hit this year, it puts us in the best place possible to face the future challenges. Thank you.
Thank you, Neil. Thank you, James and Sarah as well. So we've kind of done the formal bit which we are required to do. Without the efforts of my colleagues here and the CCG teams, none of the NHS would actually exist at all, because we wouldn't be organising the money and we wouldn't be organising the people. So thank you very much to you and your teams for all that you do. But obviously I want to talk about patients. And GP practices, which I think are a really important part of the NHS. So patients tell us that GP practices are a really important part of the NHS. And I'll often be heard to say that if GP practices fall over, then actually the rest of the NHS will too, but then I would be bound to say that. Wandsworth General Practice is actually recognised quite widely to be some of the best in London, and we're really proud of that. And I just thought I would talk to you a bit about what we've been trying to do over the last year and the current year to try and make sure that we do really, really good things for our patient care. So there's lots of stuff going on. We've made it's a really important part of what the CCG does, actually, supporting general practices to provide good care. In the last couple of years, there's been a real focus on on access to GP practices, and now patients can book an appointment between 8 and 8 on every single day of the week, 7 days a week. And that's fantastic, and that really just wasn't there a few years ago. So it's also provided, as well as an increased time span across which you can book your appointments, just an additional number of appointments, which we think is really great. So you might be able to see a GP in your practice, or it might be that you can see a GP in a GP hub in a neighbouring practice, but people all have access right across Wandsworth to this. And that's been made possible because of our GPs working together in a collaborative way. And they work together in the GP Federation. Now, this is an organisation which is just the collaborative of the practices. And ours in Wandsworth is quite mature now. It's quite kind of stable and doing some really good work, not just in access. But the reason why we can offer these appointments in the hubs is because our GP practices are working together, because each individual practice couldn't possibly provide that service all of the time. So it's been really good in terms of the benefit it's brought to our patients. Some of the other things that our GP Federation has done is to focus on workforce. So we've had education is really important for our healthcare professionals in the workforce, and so we've had a focus on primary care nursing in the last year or so, and that's great because our primary care nurses are often an under-recognised, underappreciated resource in GP practices. They are fantastic on the whole. So we've also had induction programmes. Now, this is something that each individual practice will try to provide for its staff, but actually, staff turnover, as it is in a London borough, is quite high. So we always need to make sure that new people coming into Wandsworth, coming into the healthcare professions, are able to hit the ground running and understand how to work best in Wandsworth, so they get the most out of their professional life. So this spans all of the different disciplines, so not just our nurses, our doctors, but also the receptionists and the administrators that run our GP practices as well. And our GP Federation organises that for us, which I think has been a real benefit. So there are so many challenges in primary care, so it won't surprise you if I say that actually the money in general practice is an issue. Isn't it everywhere in the world and in the NHS, of course? So there are financial challenges for primary care. We also have challenges in the estate. Not every practice is in optimum premises. We also have challenges in our IT infrastructure, and there's a lot of work needed to get the IT where we want it. We've got some fantastic IT, but really we can do better. It's so important for communication between professionals about our patients, and the IT is very important. It's just not as good as it could be yet. We've also got the challenge of the workforce, and this isn't for Wandsworth alone. And in fact, Wandsworth is probably better placed than many other London boroughs, or indeed elsewhere in the country. But we know that we've got a problem ahead with recruitment and retention of GPs and nurses and other key staff, because the workforce just isn't there. And there's lots of things been done nationally and locally to try and improve that, but nevertheless we have a lot of vacant posts around the place. This puts immense stress and strain on GP surgeries. And then, of course, we've got this inexorable rise in demand from our patients, because there's a lot of unmet need out there, and practices are very, very busy. So with all of these challenges, I'm always surprised that practices are willing to take on anything else other than do what they have to do on a daily basis. But indeed they are, and our practices are incredibly enthusiastic about the kind of quality of care initiatives that we support them to be engaged with. So just a few examples here of the kind of things that we're doing. So sepsis, you will have seen in the news a lot over the last couple of years how sepsis is kind of, it's not a new condition. It's been there all along, but there's an increased recognition of how important it is to pick up early to save lives. Educating our healthcare workforce around sepsis was a real priority for us, so we've put in place the right things so that people have the education they need across all of the staff who might see patients on a daily basis, to make sure that they've got the guidelines and the tools and the reference points that they need to make sure they can act quickly when they see someone who may have have sepsis. So that's been a real success, and we've also done work in a similar way with asthma, particularly childhood asthma, and lots of initiatives on end-of-life care, looking after those people at that end of their life. We've also had a really good go at diabetes this year. It's been fantastic. Diabetes is this time bomb that we're all waiting for to explode, and we just can't sit and wait for it to explode. As well as all the people who have diabetes, that we are improving their care. This year we've put in place a lot of other things so that we can try and help to prevent diabetes or identify people who are at higher risk of diabetes, because they're the ones who, if you support them and get the right interventions in place, they can actually prevent or delay the onset of diabetes, and that's a real win. So there's lots going on in that, and practices have really taken that on board. We've had a real go at child immunisations this year. This has long been a challenge for us, and it's a real worry because there aren't that many GPs in Wandsworth who will have seen a case of measles. It was almost not around anymore. This is so not the case now. We've seen quite a lot of cases in London this year, and this is a real worry because we want to prevent this condition in our children, and to protect children from measles, they need to be immunised. So the immunisation rates have kind of fallen across London over recent years, and this year we put in place some important steps to try and support practices to spend a bit more time making sure that people get access to these immunisations. And we think we've probably got some early success with this, but it's an ongoing programme. Just a few other examples. Prescribing. We do a lot of prescribing in general practice, and we want to make sure that the medications we prescribe are the ones that are going to be of benefit to our patients, and we have high quality prescribing. We've got a long history of doing this anyway, but there's a lot of work ongoing as well. Our rapid response visiting service. So this is the work that we've done with GP practices to give them the capacity, in amongst the daily busy surgeries that they have, to make sure that when that home visit is needed for someone who really needs to see a GP and quite quickly, that a GP is released and able to do that. And that's very important to do in a timely way, because the longer you leave it, the less likely you are to be able to get in place the things that day that you need to do to support that patient to stay at home if that's the right thing for them. We want to make sure people don't go to hospital unnecessarily, and this is one of those initiatives that is really helping with this. We've also been looking at some referral pathways that are very important. So, for example, conditions of the digestive system, physio and cancer referral pathways. When you identify a patient who has one of these conditions and needs to be into the healthcare system in secondary care, you want to make sure that you get them in a timely way, really efficiently. So we've redesigned quite a lot of those pathways to make sure it's a much better experience for patients, they get seen in a more timely way, and that GP practices are supported to be able to do that. And then finally, on NHS health checks, although this is not commissioned by the CCG, our local authority colleagues commission this, it's GP practices that deliver this in Wandsworth, and these are the over 40s checks, which is to try and pick up high risk people who might have heart attacks or strokes in the future, and we can do something now to help to prevent that. We've got a long history in Wandsworth of very successful achievement in this. It's a national programme, and that's been continuing this year, which is, in amongst all of the other things that we do, I think we're really proud that we're still able to achieve these things. So the National GP Survey is something that happens every year, and in the last year 98% of the people who responded about their practice in Wandsworth said that their overall experience of their local practice was good. That's compared to an average of 83% nationally. So that's fantastic. I'm really proud of our practices to be able to achieve that. They achieve well on a whole range of other indicators. But no complacency here. These are the new kids on the block. Primary care networks, and I wanted to just explain a bit about what they are. Given that there are so many challenges in general practice, we know that we need to continue to evolve the way that we work. And when workforce is such an issue, it's obvious that practices working together could make for a more resilient primary care. So practices have been grouping together into small groups, between 2 and 9 practices in each network. And they're forming into these little organisations, these networks, and tackling various things, and it's ranging in different networks from prevention issues, tackling health inequalities, through to getting more back office efficiency, and to work out how they can just do things better together. So it's all very exploratory at the moment. But one of the big things about it is the workforce, and there are 2 new forms of life in the general practice world, which are pharmacists, and so these networks are employing pharmacists to work in clinical practice in general practices, not in your retail pharmacies on the high street, but within your practice, seeing patients and using their skills to make sure that people are really well managed and that the quality of our prescribing is excellent. This is a real support to our doctors and nurses, and it's only just evolving, and we're already seeing really good results from it, and practices and patients seem to like it. We've also got the soon-to-be appointed social prescribing link workers, and they'll be coming on board in around November time, and each network will have one. And our social prescribers will be able to help to identify patients who have not just purely medical needs that our doctors and nurses need to manage, but actually can help them to find out ways that they can get further support in the community, and are really very well linked in with our communities in the voluntary sector, the third sector, to try and make sure people get the help and the support that we need. And I think that's going to be fantastic. It's very early days, but well tried and tested in other places, and we're looking forward to that. So it's a really exciting time for general practice, and the primary care networks are going to form the basis of quite a lot of the new types of work that we do. So that's me done on primary care, and now we're going to talk about mental health. So Robert, you headed up this way. And guests.
Hello, there we go. Great. So,
I would put it back on there actually, because it'll rustle.
great, thank you. So I'm Robert Dyer. I'm the Child Adolescent Mental Health Commissioner at the CCG, and I'm going to talk to you about the work that we've been doing to transform children's mental health services in Wandsworth, and also about the work we've been doing to involve young people meaningfully in co-production, and how we're hoping to scale that work up further over the next few years. Great, so the Children and Young People's Transformation, the CAMS Transformation Programme, followed the 2015 Future in Mind publication, which is actually a really interesting document that sets out a very ambitious programme, blueprint for how services should look at a local level. Not just intervening when young people have a mental health crisis, but intervening early and also providing more preventative services to support young people. It's about massively scaling up services, and it's about providing the right support for young people at the right time and in the right place. So moving away from those specialists only having specialist services, at Springfield Hospital, to having services in children's communities that support them in the way that they want to be supported at the earliest possible stage. And I came to the CCG 2 years ago. I came from managing a partnership with schools in Clapham. Quite often, so I've crossed the aisle, if you like. I was one of those senior school staff who had a cohort of children who often we have been working with through various different in-school interventions and working with their families. And we'd often got to a point where we felt that we needed some external specialist intervention. You'd make the referral onto CAMS, and quite often you'd wait a long time to be told the child didn't meet the threshold. So my hope was that coming to the CCG I'd have a meaningful role in transforming children's mental health services. And I was really impressed when I came to Wandsworth just how much had happened in terms of transformation. There was a really great programme. Wandsworth is already on target to achieve the national target of increasing the number of young people getting support by 35% by 2021. And we now have an additional £2 million of services annually being spent on children's mental health services, and that's on top of the £4 million that was being spent previously on the more specialist services. So we now have over 2,000 young people who are receiving treatment, And a lot of that support is support in their primary schools, it's support through their children's centres, it's support in their secondary schools. All secondary schools have counsellors in those schools. I'm not going to go through all of those list of services, but it is an impressive programme that supports children across a whole spectrum of need. Just to pick out a few, so we've heavily invested in what we call the single point of access. So where schools, like I was describing, where you're staffing schools and you've been providing intervention work and you've kind of you sort of hit a bit of a brick wall, those sorts of social workers and teachers can refer into the single point of access. Young people are triaged within 24 hours. If it's an urgent case, they are then assessed within a week, and if it's a routine case, they are assessed within 2 weeks. In some parts of the country, children have to wait many months in order to be assessed, and that isn't the situation in Wandsworth, and I think that's something we can be very proud of. I've already mentioned some of those services in schools that we've already set up, but more recently we've also invested heavily in new treatment in our pupil referral units and in Nightingale special social, emotional, mental health school, which is just by Wandsworth Common. And we know that our pupil referral units and in Nightingale School there's particularly high levels of need. Sadly, in recent years, when young people have committed suicide, very often those young people have not been known to services. And so something else we've invested in with colleagues across South West London is the COOTHS online counselling programme, so that young people who don't feel that they can speak to an adult can begin the process of talking about their needs and can begin the process of accessing help. So that gives you a bit of a flavour of the services we now have across Wandsworth. Something that's a real game changer for us now is our mental health in schools trailblazers. We've divided Wandsworth into 4 areas: Battersea, Putney, Roehampton, Tooting, and Wandsworth Town, Earlsfield. And we were one of 25 national trailblazers, which is an incredible achievement to secure that in partnership with colleagues from the STP. And that means of the population of about 8,000 pupils in each of those areas, 500 young people are receiving treatment. Almost all the schools, or 90% of the schools, have expressed an interest in being part of the trailblazers. And as from January, we'll have a new trailblazer in Battersea. We're learning lessons from the first trailblazer, which was quite heavily secondary focused and focused on children in Key Stage 2, Year 6, the top of primary school. And in our Battersea trailblazer, we've got an even stronger focus on support of children in primary school settings, particularly children that have experienced some sort of trauma, some sort of family trauma, which we know is a big area of need and a gap in provision. It feels to me like now is such a crucial time to involve young people. We've got all of those services, we've got all of those resources, but we need to make services more relevant and more responsive to young people, delivering in the way that young people tell us those services should be delivered. So over the last few years, we've been working very closely with the Youth Council, who have helped us to create our CAMS map of services. I think we were the only borough in South London to have a CAMS, a proper map of services, a proper list of services that went out to all of our schools and all of our GPs' practices. And that was done in partnership with young people from the Youth Council, who we're going to say a few words in a moment. I would also say we've been doing some fantastic work with Wandsworth Community Empowerment Network, who've been running an annual BAME mental health conference, which is fantastically attended, and the sessions are facilitated by those young people. That's led to a new focus on how we can better support BAME young people, both in school but also in community settings. And we're funding a pilot project through Wandsworth Community Empowerment Network and partners. That's just one of a number of outcomes that's come through those conferences. And the other thing I want to say is we want to, as I say, scale up our co-production work, and we have therefore commissioned a new project, a Young Commissioners project, and those people from the organisation are going to say a few words in a moment. But for now, I'm going to invite young people from the Youth Council up, Connor and Maisie, to say a few words about the co-production work that they've been doing over the last few years.
Is 12 to 19-year-olds who meet together every Tuesday from all across the borough to discuss what we feel are important, not only in the borough, but what young people feel are important to them. So we talk about it, and we design our campaigns yearly. So within the campaigns, we plan events and activities that we can get other young people in the borough involved in, so that we can increase awareness on the issues that we feel are important.
In 2018, mental health awareness was one of our main campaigns. A few of the things we did were working with the CCG to create the CAMS mental health map, which is showed, and also we trained 120 mental health champions in 5 different schools around the borough.
So then, since we've also extended that as well, so within that program we also allow young people to go on and then teach their peers as well. So then also, like, we've also been involved in other like mental health stuff, so like mental health champions, the map, and then also like we just also like to keep a grip on what else was going on inside the borough. Like we work closely with like the CCG, we've done quite a lot of work with them and hope to do more. So stuff like that, and then we also help with like stuff like CCG, like to unify reports. Like we were heavily involved in the restructuring of CAMS and stuff like that. So we feel as if, because we were the only young people there, so we felt it was really important, if it's a service about young people, to get young people's inputs and insight on what we feel that young people need and want in the service and what it's shaped like. And ultimately we feel as if that's a real change and more young people engaged. And it's like, and we also help with any like reports that are going out. We also help youthify them, if you will, to make sure that when they do go out, young people will be able to understand them and read what's going on, to get them involved as well. Because obviously if work's being done about young people, we need to get young people involved and engaged so that they are able and informed about what's going on and how they can not only help themselves but also who to go to for that help and how everything is structured and how it all goes.
I think there were 3, you guys have got 3, where are your priorities? So those are the 3 priorities that young people identified through the climate report, which you guys did. And so caring is sharing. Would you like to say anything about caring is sharing? Or sharing is caring, rather. So that and involving us, and you've proved everything. Is there one of those that you'd like to pick out as being a key one that you'd like to say anything about?
I feel like the map definitely for a fact, because it's one of the first of its kind, and it's like, so like we obviously like got like asked by the CCG about what we would like, so obviously sharing is caring, so we decided to share our input and help with that as well.
Great. Thanks, guys. So I'm going to invite up 2 colleagues from Silver Lined Horizons, who have been commissioned by young people. So we worked with young people at Chestnut Grove Secondary School in order to develop a specification for a young commissioner service, and then ultimately to commission an organisation to deliver our young commissioners programme. We're coming towards the end of the local transformation plan, the 5-year CAMS transformation programme, and we're moving into what's called the long-term plan, the NHS long-term plan. And it's actually a really important time for us to take a fresh look at those children's mental health services, and the way that we're going to do that is to involve young people, to train them as young commissioners, and for those young people to go out and to visit all of those services and to help us to assess those services. It's amazing when you visit providers and you ask them about the views of young people and to ask them what young people think of their service. Invariably they go, oh, young people love us. You know, this is exactly how you need to be delivering services. But when young people visit those services, you often get a very different message, and that needs to be part of what we do going forwards. And so I'm going to introduce Natasha and Frankie, who are leading that project, as from this month, just started. So.
Just started, yes. Thank you very much for having us. So, yeah, just to quickly introduce ourselves. My name is Natasha. I'm the founder of an organisation called Silver Lined Horizons. We are a youth engagement company. So we are delighted to be here, working on the Young Commissioners Programme. Really quite hard to follow your presentation. Very excited to hear. We think that lots has been happening already. So we are going to be leading on the Young Commissioners project. Frankie has literally just started on Monday, so it's good to hear all the different things that are already going on. So we were asked to talk a little bit about what we're going to do. So just to give you a highlight of some of the steps that I think that we're going to go through when we lead this project is really going to start by just finding out what's going on already. You know, we're not going to reinvent the wheel. Some fantastic stuff that you've heard from the Community Empowerment Network, the Youth Council, lots of different programmes out there. So we're going to reach out and we're going to build relationships. Then we're going to communicate the message. What is it that we're trying to achieve? So Young Commissioners Programme, what does that actually mean? We're going to do this with young people because it's really important that we understand what being a young commissioner means to them. So we're going to work with schools, with youth groups to find out what does it mean to be a young commissioner and hopefully get them involved in, you know, really influencing and designing services going forward, building on what we already know is really good stuff going on. So in terms of recruitment, training and support, you know, really important that we are recruiting a diverse group of young people. So keen to hear from anybody who are providers of services for young people about how we can get those young people involved. In terms of training, what we know is that we want it to be a two-way process. You know, we want stuff from the young people. We want them to be involved in moving forward, designing services, but we want to make sure that they get something out of being involved. What does that look like? You know, what can they gain? What can they benefit? And I'm sure the Youth Council, you know, would love to hear from you about what's important for young people. We know that things like accreditations, you know, incentives to try and get them involved is really key. So we'll be looking to train young people also on the commissioning process, which we know can be quite confusing, but hopefully we can break that down for them. We've written logistics and passed to Frankie to talk about the logistics.
Okay, so hi everyone. So as Tasha said, my name is Frankie. So I've just started on Monday as the head of, oh God, here's where I get my title wrong already, head of Programmes and Development for Silverlined Horizons. So what I'm really excited about this project mostly is kind of finding out more about what's currently going on in Wandsworth and what kind of what services are like for children and young people, you know, going to school, living or working in Wandsworth as well. So as Natasha said, we've talked through a bit of the kind of process before we actually get into action. Now, by getting into action, I'm not going to tell you what that's going to look like because that's going to be for the young people that we work with to just kind of shape that out and frame that as in how they think appropriate with our support. But the types of things that we will be doing will be actually going into the services within Wandsworth, which I'm very curious to find out a little bit more about. And I guess in a way, the Young Commissioners Programme will be slightly like a Young Inspectors type programme. Young people will kind of go in, and I think your experience often starts from the moment that you walk into that room. So say, for example, you're walking into a doctor's surgery. I think it's going to be really interesting to hear feedback from young people as to what their experience was like from start to finish. What was the receptionist like? What was the waiting time like? How was the, you know, how does the room look? So I think after that, we are going to kind of gather our thoughts and really listen, probably get some key people in the room at this around some feedback and recommendations that have come from the project. This step 8, we've got the making change happen. I think it's so important to be honest with young people right from the onset. And as I've just started, it's going to be interesting for me to have some conversations just to find out kind of what our scope is, what's possible and what's not. So it might be that we get some young people that come in and actually are like, yeah, we need to shut that down. Or like, they might say something quite, you know, big. But obviously we need to be managing expectations. So we need to find out kind of what is, you know, what is possible and what is not. And I think by them then sharing their recommendations, we can really review this and see how we can move forward. I'm going to let Natasha describe the future opportunities.
Very quickly, sorry, right, I've got 30 seconds. So basically, you know, lovely to be here, delighted, really excited, like I said, to build on what's already going on. If anybody, you know, is interested in hearing a bit more, then we're around for the rest of the afternoon. And we just love to hear from you going forward. Thank you very much.
Wow, thanks very much, guys. It's so important for people like me and my colleagues in the NHS to hear from the people that our services are for. So, you know, thanks so much for the kind of the time that you spend on this and the effort that you put in. And I'd like to know how I can get youthified, if that's all right. So we've got some time now for some questions, if anybody would like to ask anything of our panel members here. Go ahead. Thank you, Tom. Do you want a microphone? Thank you, Fraser. Will you be the runner?
A couple of points, Nicola. I think it would have been helpful if, as we had with the annual report, if for the presentation on mental health, we'd had a copy of the overheads, because Robert went through them very quickly, and it would have been nice to have gone away and read them in more detail and worked out exactly what they were saying. But
You'll be able to get a copy afterwards. We couldn't get them published in time for this just because of the arrangements, but they'll be available.
I mean, there was an enormous amount of interesting detail, but you couldn't actually take it all in from the screen. Looking at Neil's annual report, annual accounts, I'm aware that north of the river, a lot of the CCGs have been operating at a significant loss, partly due to an organisation called GP at Hand, which has caused all sorts of financial problems. And I wondered whether Neil could give us a more precise impression of the accounts in terms of figures, whether Wands was actually finished with the surplus that it was expected to at the start of the financial year, and what impact GP at Hand has had on the Wandsworth practices.
So I can deal with the financial issues around GP at Hand. So there was no impact in the accounts for 18-19 around that, and we're in the process at the moment of working with North West London to understand the real impact of the change. So the funding formula that we currently have at the moment doesn't really take into account the arrangements around this. So we do have, and we are having to build into our individual financial positions the impact for GP at Hand, but it is not yet finalised, and as you quite rightly say, there's a significant impact. It isn't just within London, just because of the way the model works, because in effect it's like a branch surgery, so you can have GP at Hand operating anywhere in the country, but all will get reported within North West London. So I can't give you any more detail at the moment because it hasn't fully been worked through. I mean, I don't know whether anybody else on the panel wants to.
Well, I was just going to say, I mean, it's a new model, and actually the way we've set up, the way we run our financial regime in the NHS doesn't actually account for this new model. I think that's basically the problem. But everyone is now acutely aware of it and are working together nationally to try and find the right answer, because what the right answer is not to say we don't want to deliver new and innovative ways of delivering services to our patients. What we need to do is make sure the financial regimes make sense and that we can support that. So we will make sure as an NHS, as a corporate NHS, that we sort through that and that we manage that, the finances. The most important thing is actually that we get the right type of services for our patients. And actually one of the things that we are looking at across South West London and in Wandsworth is how can we offer that kind of service to our patients, but not necessarily through GP at Hand. How can our local practices offer something to patients that means that they can access Skype, they can access different ways. I don't know if you want to say anything about the different ways in which they can.
Yeah, so there are a number of practices, I'm not quite sure how many it is at the moment, but more than half of the practices have online consultation systems now, so that you can contact your GP surgery using an online mechanism. So that's a really great step forward, and practices are still working out how that works for them. And as I say, they're not all on board yet, but we're hoping there will be. And also, we are looking at how we do video consultations in GP practices. So practices will use this in a variety of ways, but that's being rolled out at the moment, just starting really. But we hope by the end of this financial year that a significant number of practices will be actively using this. It's still kind of emerging how we can use these models to offer better care for our patients. What we don't want to do is to make care less accessible for some people through this. So for me, not increasing inequalities is a very important element of this. We want to make sure that we get it right.
And the surplus, did you want to just mention what the surplus was?
It was a break-even position for Wandsworth CCG in 18-19. That was our target. So we didn't make a surplus. It was a break-even. That was our target.
So you didn't actually. The target was to make a surplus.
Oh, sorry. Yeah, sorry. A break-even against the surplus target. Yes.
And what was the surplus?
2 million.
Okay. Malik.
Thank you, Nicola. I just wanted to share some props with you. We've been working in Wandsworth now since 2001. So my organisation has been here now for 18 years. And what I've noticed over the last 3 or 4 years, particularly since the CCG, the PCT, what are we? Are we a CCG or are we a PCT? I get confused.
Yeah.
Whatever the latest body is, that there's been a lot of, for us as a community network, that is for about 10, 12 years, not really had an engagement with the NHS. Over the last couple of years, there's been a significant step change in that. And there's just a few people I need to acknowledge. Your clinical lead, of course yourself and Mark, but Tom Coffey, the clinical lead in mental health, I think he's made a real difference in the mental health work that he's leading. But also 3 colleagues who often don't get acknowledged. I know Robert Dyer, Mark Robinson, I don't think he's here, and Amrinda Sehgal. And I just want to say that every time we've called them and we've asked them to come out to meetings, they've always stepped up, come down to the estate, come down into meetings, sometimes very difficult conversations, sometimes awkward conversations, but they've been a real credit, I think, to your organisation. I've often been frustrated in the past that you don't actually see colleagues, commissioners and managers, and they're actually behind walls. But I think those 3 colleagues in particular have really made a difference in terms of coming out into the community. Robert mentioned our conference. To see the NHS coming in front of 400 young people and talking, Josh Potter was also at the conference, makes a real difference in the hearts and minds of people, because they don't just see the NHS signal, they see people representing the NHS. And I just want to say thank you to them, and thank you for your leadership of the organisation, encouraging them to work in that way.
No, thank you, Malik. I think it's, well, Mutual Appreciation Society, it's really great for us to get out to be part of the communities that we serve. It's so important. So I'm really glad to hear that, my teams of people are out there. That is what I would want to see. So thank you very much. I'm pretty sure it will continue to reap rewards through the year. These are building blocks, aren't they? These things, these relationships, these conversations, they take a long time to develop, but we're doing it. That's great. Thank you. Anything else? Lilias, hi.
There is a large article in The Guardian today about the NHS's contributions to emissions, carbon dioxide emissions. And I wonder what the NHS in Wandsworth has thought about reaching a sustainable and zero carbon future.
Oh, I haven't read The Guardian today, I'm sorry.
I know you've got a lot of other things to think about, but we do have to think about it.
Yeah, we do.
So as an NHS organisation now, I'm going to talk to you and not know the answer, so I'm sorry about that. But I'm going to promise that we can get something to you outside, because actually as an NHS we are required to look at our sustainability and our carbon emissions and so on, and I'm sure that we can get you some more information about what we've been doing. We definitely are doing more to actually engage with our staff and get them to use more sustainable transport. We don't provide parking spaces for our staff. We try to encourage use of public transport locally, all of those kind of things, which are part of our, not only part of being sustainable, but also about our healthy workplace and encouraging us to use bikes and walk more and to do more healthy living actually as a team. So we do a lot of that kind of thing. We do have something around our estate, I'm pretty sure, that we have to report on, which I'm sure we can get to you afterwards. Unfortunately, I don't have it on the top of my head, but I know that we are required to do it and that we will have some information for you if you need it.
There is an accreditation that GP practices and primary care networks can now get for this, and I think that's been quite supported locally, and some people seem quite keen to be working on that, as well as all the other things that they're doing, which I think is fantastic. But it's only just started really very recently, so I mean maybe we could feedback on that with time as we understand what the uptake is like and what people do. But great point. Important to talk about this stuff. Thank you very much. Yeah. Anyone else want to ask any questions of us? No. Okay, so, another one. Oh, two more. So Tom, I'll just go behind you first of all. Thank you.
Hi, sorry, I wasn't going to ask a question until you mentioned the word measles. Is this the result of that guy who managed to persuade most women not to have the MMR jab? So and it's still going on. Is this?
Yeah, there's a whole kind of history behind vaccination rates in the UK, and yes, there was one a very long time ago now. Some studies that were done that showed what the adverse impact of vaccinations was. subsequently proven to be absolutely not the case. But nevertheless, that kind of has been inherited by populations, and people are still quite concerned about vaccines. But it's not just that. There's a whole lot of social media, anti-vax campaigning, and all sorts of things that we're kind of up against. And people with a whole range of views and opinions. There's quite a lot of culturally sensitive stuff out there as well, which means that certain populations are much less likely to have vaccine uptake than others. So we're trying to, forge our way through all of this and make sure that we protect our children. It's really, really important. And we do a lot of work on that, so it's just an ongoing campaign, really. But yeah. Tom, did you want to go again?
Thank you. Looking forward, as you explained in your presentation, the 6 commissioners in South West London will come together as one. One of the difficulties of that is that at the moment, because the meetings are in public and the public are allowed to attend the 6 local commissioning group meetings, they're fairly accessible. And I'm trying to work out after April what the access will be by the public to meetings of the commissioners. Now, will there be local meetings as well as the regional meetings?
So we will still be having the South West London CCG in public. This is assuming that this goes through, because we still have to go through a process to get that all agreed. And we will try and rove around South West London, I think, is our intent. So we will be local sometimes, and sometimes we will be in other parts of South West London, but we'll always be in South West London. So we are going to rove around South West London as a governing body. There will still be local people to talk to. The whole point of us doing some of our work together is that actually we can centralise some of our functions that make sense and still retain all of the locally facing staff and as much of as we can of our locally facing staff and those that are actually on the front line doing stuff that we've talked about today, which is really fantastic work. But what we can do is we can save some resources by doing some things together. Also, some of the real benefits for us in working together across South West London has been our ability to make bids for funding and to work together for populations to ensure that they get the same level of care. So I'm going to give you 2 examples. Children, young people, mental health. The reason we've got so much money going into children, young people, mental health across South West London is because we bid as South West London, and we were trailblazers, national trailblazers, and we've managed to get that rolled out across all 6 CCGs in South West London. Nowhere else in the country has managed to do that. And that was because we came together and did it together. Secondly, what we call effective commissioning initiative. We now have thresholds for certain procedures that are not of good clinical effectiveness, but that is standardised now across the whole of South West London, and we reach national requirements on that, and we're second best in the country on that in South West London, and that's because of the work we've done across South West London. So there's a number of reasons why we want to work together. One is so that we can only make efficiencies in the places that we need to make efficiencies, such as governance and back office, and also so that where there is potential for us to work together in a really good way, we can do that. But we recognise that we have a public, and what we need to do locally is to engage with people. And James, do you want to talk about what we're going to do?
So outside of the public governing bodies, where obviously it's a meeting once every 2 months, it's in public, it's a meeting in public, it's a public meeting, there's a set of papers, and then an opportunity to ask questions. We have a lot of other places that we do a lot of engagement and involvement. We come out to other people's meetings with our staff, and we engage people in other people's meetings, as Malik was referencing, and we also have a PPI reference group and a thinking partners group as well. And it's our intention to carry on with a lot of those other engagement structures and involvement structures outside of the formal public meetings. So although there'll be a governing body for South West London, so there won't be a Wandsworth governing body that meets in public, all the things that Wandsworth CCG does at the moment to make sure that it's fully engaging with people and getting input to its work, all of that is continuing, and we will still have a professional staff that does that work for us and works really closely with groups in the community. Additionally, we also, quite a substantial amount of our work gets reported up through to the Health and Wellbeing Board as well. So also we'll be in public at the Health and Wellbeing Board. So whilst it won't feel exactly the same as it does at the moment in terms of having that Wandsworth public governing body, many of the ways that we currently are engaging and involving will continue.
Good. Okay. Thank you, James and Sarah. Thank you very much for all your questions, everyone. I think I need to wrap up now because it's time to finish. So I think all that remains is for me to say thank you very much to my board for their work and commitment through the year, and thank you to the GP membership for their ongoing support, to my CCG colleagues, and thank you to you all for coming today. It's hugely appreciated. It never fails to amaze me how people give up their time to be interested in and support the local NHS. So it really is very much appreciated. Thank you all. And do spend a bit more time in the marketplace, and there might be some of those good cookies left as well if you go in there. Thank you very much. Thank you for